Good morning to everyone. So today I'm going to discuss about mental status examination. So in the psychiatric nursing, the mental status examination is a very important tool to confirm or to diagnose the client condition. So through this only, either psychiatrist or psychologist, even nurses, they are going to identify what kind of mental disorder the patient is suffering. So let us discuss about the mental status examination. So the first component is general appearance and behavior. In the general appearance and behavior, the examiner is going to identify the physical appearance of the client, eye contact, that means whether the client is maintaining the eye to eye contact or not, and grooming level, and what kind of attitude the client is having towards the examiner, what is the gait and posture of the client, motor activity levels, and rapport, and any kind of hallucinatory behavior or presence are absent, they are going to assess. The next one is speech. So for assessing the speech, the examiner will ask one question. So whatever the answer the patient is giving, based on that, they are going to identify the speech disorders or presence or not. For example, tell me about your family. So you can ask any open-ended questions. So whatever the answer the client is giving, based on that, they are going to identify the rate and quality of the speech and even productivity of the speech, tone, tempo, and relevant information the client is giving or not, that also they are going to assess. Next one is thought. So the examiner will ask the question. So based on the answer whichever is given by the client, through that they are going to assess the stream, form, and content of the answer. So for example, tell me your job experience. That is a question. So whatever answer the client is giving, based on that, they are going to identify the stream and form, as well they are going to identify the content. So here the stream, they are going to identify the whether the client is having any circumstantiality or tangentiality or flight of ideas. And in the content, they will assess the obsessions, phobia, and preoccupation. And even they are going to assess the delusions. So delusions means nothing but it is the, in simple form we can say that the delusion is nothing but it is a strong unshakable beliefs, we can say. So the examiner will ask the questions like, do you think anybody is trying to kill you, and who is trying to kill you? If the client says that somebody is following me, somebody is trying to kill me, like that, if the client is giving the answer, it indicates that he is suffering with delusion of persecution. If the examiner will ask, do you have any extra power? If the client says yes, that is called delusion of grandiosity. If the examiner asks, do you think your life partner is not faithful to you? If the client accepts and says yes, that is called delusion of infidelity. Like that, we can assess the delusions. And even some more also is there, like thought control, delusion of control, delusion of reference, like that. So many are there. Next, mood and affect. So the examiner will ask, how do you feel now? So if the client says, that is called subjective data, I am good, I am happy. Then in the objective data, the examiner will observe. So really how they looks, whether happy or sad. So based on that, they will write the mood and affect is appropriate or not appropriate. Next one, perception. For assessing the perception, they used to ask the questions to judge the illusions or hallucinations, any kind of these things are present or not. Illusion means nothing but in simple we can say that it is a false perception in the presence of stimulus. So for example, you can see in the image that is a pencil. So we will show the pencil and we will ask, what is this? If the patient says it is a pencil, then there is no illusion. If the patient says something other, then that indicates the client is suffering with the illusion. And same like that, you can also assess the hallucinations. Hallucinations means it is also like false perception only, but here there is no object, there is no stimulus. But whereas in the illusion, the object is present. That is misinterpretation. In a hallucination, there is no option. Sorry, there is no object. For example, the examiner will ask, are you hearing any voice or sound when you are alone? If the client says yes, it is called auditory hallucination. Then, are you seeing any image when you are alone? If the client says yes, that is called visual hallucinations. Like that, we can assess the auditory hallucination, visual hallucination, gustatory hallucination, tactile hallucinations, as well olfactory hallucinations also we can assess when you are doing the mental status examination. Next one is consciousness. So by seeing the patient itself, you can know that whether he is fully conscious or semi-conscious or unconscious or comatose. Next, you can assess attention and concentration. So for assessing the attention and concentration, you have to ask the questions to the client. For example, you can say, so you please repeat pen, cloud and pillow, like that. So how many words he can repeat? Based on that, we can judge the attention and concentration level of the client. And even you can say, can you please tell me the backwards from 10 to 1? So if the client is saying okay, if not, then the attention and concentration is poor. And same like that, you can also ask the mathematical calculations like 100 minus 7, 40 minus 4, like that, so that you can know the attention and concentration levels are aroused or not. Next one, you can assess the orientation of the client. In the orientation, time, place, person, and even day, month, year also you can assess. So for example, time, what is the time now? If the patient says around 10 a.m., it's okay. If the time is really 10 a.m. means that is correct. Person, so you have to show any relative of the patient. For example, mother, father, brother, somebody. So who is this? You have to ask. If the patient is identifying, that indicates that the person is having orientation towards the person. Next, same like that place. So where are you now? Which place it is? What is the name of this place? Like that you can ask. If they are saying correctly, then you have to write the patient is having the orientation towards the time, place and person. If not, you can write absent. Then same like that, you can also assess the memory. So immediate memory, recent memory and remote memory you have to assess. So for this, you may ask the questions like, for assessing the immediate memory, can you repeat the name which I quoted before? So if the patient says, it is okay. If the patient doesn't recall, that indicates his immediate memory is not intact. To assess the recent memory, you can ask, what do you had in the morning? Idli. If it is correct, the recent memory is present. In the remote memory, which year you born? Like that you have to ask. If he says correct, then the memory is good. So like that you can write immediate memory is good or recent memory, and what about the remote memory? So you have to write by assessing the memory. Next one is intelligence. So for this you have to ask some questions. For example, who is the PM of India? If the patient is saying correct answer, then he is having good intelligence. If he is unable to say, then that is poor intelligence. Next, abstract thinking. So here you have to ask the questions. So can you tell me the difference and similarity between the apple and orange? If the patient is saying correct, that is good. If he is unable to tell, that indicates his abstract thinking is poor. And judgment. So to assess the judgment, so personal judgment, social judgment and text judgment is there. So you may have to ask the questions. Based on that only, you are going to say that whether the client is having the judgment power or not. So for example, what you will do when your house got fire? If he is giving the answer, I'll call to fire station. Another question, how will you dress for a party? If the patient says grandly, that indicates the judgment is intact. So like that you have to ask some questions. Based on that, we are going to assess the judgment level of the client. Next one is insight. So to assess the insight, you have to ask the question. So in the insight, total 6 degrees are there. So whatever the answer the client is giving, based on that, the insight is going to say whether it is the first degree of insight or second degree or third degree. So according to the client answer, the insight is going to tell. For example, why you came to hospital? If the client says, I am alright, but my family members brought me here. So which degree of insight it will come? We have to write. So like that, we have to write the degree of insight, either first, second, third, fourth or fifth or sixth. Which one is suitable? We have to write. So like this, we have to conduct the mental status examination. So through this, we are going to identify what kind of mental disorder and the patient is suffering, as well what is the level of judgment, memory, all the components we are going to identify. So I hope this video will be useful for you, and so many things also is there, but very in a very short form I made the video. So I hope it will be very useful for you. So thank you everyone.